Welcome to our 5 on 5. Pleased to be joined today by closest to me, Tanya Phillips with Jackson County Public Health and Shawn Martinez with Josephine County Prevention. Shawn, I want to start with you. We're talking about opioid misuse specifically. Can you give us an idea of why there's been such an increase in opioid misuse over the last few years?
Well, I think I'll start with saying that our opioid misuse, abuse is not new, and that we are seeing like an evolution of opioid use, misuse, and abuse, substance use disorder. And the rise is happening on counterfeit pills. So that is where we're seeing an increase in, for instance, fentanyl that's being found in the counterfeit pills.
Mm-hmm. Yeah, and Tanya, as Shawn said, a lot of conversation about fentanyl. Yeah. I'm sure your agencies, of course, work together. What about the dangers surrounding that particular opioid? Can you touch on what the impact has been here in Southern Oregon?
Yeah, absolutely. And I'll kind of piggyback a little bit around like the opioid epidemic. You know, when we really started to see the opioid epidemic begin, it started with prescription pills. They were being prescribed more often, and then that's where you saw an increase in fatal and non-fatal overdoses. Mm-hmm. And then the next wave, that second wave, we saw an increase in overdoses, fatal and non-fatal, related to heroin or involving heroin. And then now we're in this third wave of the opioid epidemic where, again, we're seeing more fatal and non-fatal overdoses related to now illicit or illicitly manufactured fentanyl. And so when we're talking about fentanyl, it is a synthetic opioid. It is 50 times stronger than heroin and 100 times stronger than morphine. Wow. And when we're talking about fentanyl, I think it's important that people understand that we really look at it as there's two types of fentanyl. You have pharmaceutical fentanyl, and then you also have illicitly manufactured fentanyl. Pharmaceutical fentanyl is made by pharmaceutical companies. You know the ingredients in that medication. You know how much chemicals, ingredients are in that medication as well, and it's prescribed by doctors, severe pain, usually like end of cancer stage. And then you've got illicitly manufactured fentanyl, where it's being made in
drug labs, or maybe I should say illegal drug labs, yes, to be clear. Yes.
And it's in the drug market, and you really see that in the form of liquid and powdered. We really see it more in that powdered. And the thing with powdered fentanyl, and when it's illicitly made, is that you really see it, it can look like other drugs, so it can resemble other street drugs. It can be easily mixed into drugs as well. And then what Shawn alluded to around counterfeit pills is that drug can then be put into counterfeit pills where they're made to look like other prescription opioids, but it has fentanyl in it. And so that's the problem, is when people are buying illicitly manufactured drugs, they don't know what's in these drugs. It can have other drugs in it, it can have other chemicals in it, and you don't know what is in it, and you don't know how much is in it. And so, you know, that's part of that hiccup there.
Yeah, so dangerous.
It is very dangerous. Of course,
it's already dangerous and powerful, as you said, but then made on a unsupervised, for lack of a better word, level. Okay, well, when we come back, we're going to talk about a PSA, a campaign that's launching. Stay with us. We'll be right back. Welcome back to our 5 on 5. Again, we're here with Tanya Phillips from Jackson County Public Health, closest to me, and Shawn Martinez with Josephine County Prevention. Tanya, you were talking right before we went to break, obviously, about the power that these fentanyl pills and other forms have. What are we seeing, again, in our community? People need to know this stuff.
Yeah, absolutely. So really starting in 2018, we started to see illicit fentanyl in our drug supply here, and then early in 2021 we saw it really become the predominant illicit opioid in our community being sold and used, whether it was intentionally being used or accidental. And again, we're seeing it in what we call counterfeit pills being sold. It looks like OxyContin is an example. Again, it looks like other drugs like methamphetamine, cocaine, and then also in other drugs like heroin. And so there are associated risks with drug use in general, where you are going to see It can lead to, dependence and addiction. It can have impacts on, injury, accidents, health problems, academic, work-life problems, financial relationship problems as well. And really why there's so much attention around fentanyl is because of the number of fatal and non-fatal overdoses that we've seen.
Absolutely.
And that's why there's so much attention around when we talk about fentanyl. And in our community and also, across the United States, you have seen an increase in fatal and non-fatal overdoses. You have seen an increase in hospital admissions for an overdose, and also our first responders are making more calls responding to overdoses in our community as well.
Yeah, it's widespread,
Yeah.
as we know. Shawn, this campaign that's being launched, I believe, about opioids called If Not Now, When? Why have you, Jackson County, and others joined to launch this effort?
Well, I think because the fact that substance use is not new, opioid use, misuse, abuse, our community really needs to come together and let's address the impact that this is having. Become educated. We need to prioritize prevention, talk to each other, educate each other, support each other, and now is when. Now is now.
Exactly. Well said. And Tanya, but is there a website? Where should people be reading up on this stuff? Because these things, people need to know this.
Yeah, absolutely. I always really try and direct people. There's a really good website from the Center for Disease Control where they're talking about just the basics of opioids. So that's a really good place to start. And of course, there's more resources on there, but also other good websites will be the Oregon Health Authority and also SAMHSA.
Okay, all right, and I know we've all seen this PSA. The PSA is part of the program that's being launched about the story of Alex, a young Rogue Valley man that died due to a fentanyl overdose. His parents want people to hear Alex's story. Take a look.
My name is Tammy, and this is Tomas, and Alex was our son. We were just so in love with him. I mean, we were just absolutely in love with this child.
Once I started seeing him not want to play football, I knew something was different. I've caught him and his friends, messing around with weed.
Everybody kept telling us over and over and over again, he'll grow out of it. Fentanyl is purposely laced and disguised in so many different drug forms that it can hit anybody. Like our son died alone on the bottom of a damn bunk bed. I have his clothes in a basket. They slide under my bed. I'll just breathe into it.
I read my son's messages, look at the videos he sent me.
I miss you.
Something's off with my son, and I literally played it in my head, it won't happen, he'll be okay, and I was wrong.
Powerful story. Shawn, your thoughts?
Well, substance use impacts all of us. It's very rare these days that someone has not been impacted by substance use, whether it be personally, they've struggled personally, they have friends, they have family, aunts, uncles, nieces, friend of a friend. Now is the time that we can come together as a community in unity and take action so that the healthy choice is the easy choice.
Anything you'd like to add? I know it speaks for itself, the PSA.
Yeah, just, really piggyback what Shawn had talked about is, I think it's time for us to come together as a community. Substance use disorder impacts so many of us, just like that family had shared their experience, and we know there's a lot of other stories very similar from that. And, my condolences go out to those families, but we're at this point where let's come together as a community, let's heal, let's move forward, let's protect our youth going forward, let's help people who do have substance use disorder. Let's reduce stigma, let's connect people so that we can heal and move together as a community.
Couldn't say it better. Thank you both so much for coming here and talking about it. Obviously very important for our viewers to learn about. Stay with us. We'll be right back.